Tea is a widely consumed beverage and is often considered a healthy choice, especially when we're seeking relief from stress or nausea. However, during pregnancy, the type of tea you choose can make all the difference in the health of both the mother and the baby. While some teas offer benefits, others can pose serious risks to the pregnancy, affecting everything from fetal development to the well-being of the mother. In this video, we'll talk about 5 types of teas that are commonly consumed but can be dangerous during pregnancy. From calming teas to those that aid digestion, you'll learn about the risks posed by seemingly harmless beverages. If you're pregnant or know someone who is, keep watching to find out which teas should be avoided and why. Chamomile tea is widely consumed for its calming properties and its ability to help with insomnia and anxiety. While it is very useful for relieving stress, it can be dangerous during pregnancy. Excessive consumption of chamomile tea can stimulate uterine contractions, which increases the risk of premature labor. Additionally, chamomile tea can have a relaxing effect on muscles, which, in large quantities, may affect uterine muscle tone. While an occasional cup is not harmful for most pregnant women, it is essential not to overconsume. Safe alternatives for relieving anxiety and improving sleep include lavender tea or ginger tea. Mint tea is often used to relieve nausea and promote digestion. While mint tea has many benefits, it may not be the best option during pregnancy. Excessive consumption of mint tea can cause unwanted effects on the uterus, including contractions and reduced milk production after birth. Additionally, mint can relax the muscles of the digestive tract, which can cause abdominal discomfort in some pregnant women. While an occasional cup should not cause issues, it is important to consume mint tea in moderation. Safe alternatives for relieving nausea during pregnancy include ginger tea or lemon tea. Licorice tea is known for its anti-inflammatory properties and for soothing sore throats. However, consuming licorice tea during pregnancy should be avoided. Licorice contains glycyrrhizin, a compound that can increase blood pressure and affect sodium and potassium levels in the body. This can result in hypertension and increase the risk of preeclampsia, a dangerous condition during pregnancy. Additionally, excessive consumption of licorice can trigger uterine contractions and even increase the risk of premature birth. Therefore, it is essential to avoid licorice tea during pregnancy. Safe alternatives for soothing sore throats and aiding digestion include ginger tea and chamomile tea, in moderate amounts. Ginger tea is widely recommended to relieve nausea and vomiting, especially during the first trimester of pregnancy. However, excessive consumption of ginger can be harmful. While it is effective for alleviating nausea, ginger can increase the risk of bleeding and affect blood clotting, which is particularly risky during pregnancy, especially in the later stages. In these large amounts, ginger can also cause gastrointestinal discomfort, such as heartburn or abdominal pain. The recommended amount of ginger tea is 1 or 2 small cups per day. This is enough to reap the benefits without running risks. Safe alternatives include mint tea or lemon tea for a milder way to relieve nausea. Hibiscus tea is known for its antioxidant properties and its ability to help regulate blood pressure. However, during pregnancy, hibiscus tea should be avoided as it can cause uterine contractions, which increases the risk of premature birth. Additionally, hibiscus can affect the production of hormones necessary for maintaining the pregnancy. While hibiscus tea has benefits, its stimulating effect on the uterus and blood pressure makes it risky during pregnancy, especially in the early and late trimesters. Therefore, it is recommended to opt for safer teas for maternal and fetal health. Safe alternatives include ginger tea in small amounts or lemon tea. During pregnancy, it is essential to be mindful of what we consume, especially when it comes to teas and other natural beverages. While many teas offer health benefits, some can pose serious risks to both the mother and the baby. As we've seen, teas like chamomile, mint, licorice, ginger, hibiscus, and even cinnamon should be avoided or consumed with extreme caution during pregnancy due to their potential adverse effects. Whenever possible, consult a doctor or nutritionist before adding new teas to your diet during pregnancy. There are many safe alternatives, such as ginger tea in small amounts or lemon tea, which can help relieve common pregnancy symptoms without risks. The key is moderation and prioritizing safety. Remember, this is an educational video and should never replace a visit to a doctor or healthcare professional. If you found this video helpful, don't forget to like, subscribe to the channel, and leave a comment below. We'd love to hear your thoughts. If you're pregnant or know someone who is, Share this video so that they can make informed choices about the teas they consume.